Hello, in this video we're going to cover how to create clinical logs in HealthTasks. So when you log in as a student, this is what you are going to see. It's your main home screen. You can either launch a clinical log right from here, or you can go over to your clinical logs on the sidebar, and then you can create a new clinical log here. It's going to go to the same place. So let's go ahead and just click this button. So the first thing you're going to want to do is select the classroom that you're creating a clinical note for. This will populate the skills checklist that is specific to that classroom, as well as all of the fields that are specific according to what your educators would like. So I'll just pick ICU for this example. As you can see, these key icons just appeared. I can show you another classroom that does not have this. The difference is this is a classroom that has location verification enabled. So if we wanted to create a start time using a location code, we could easily do that by clicking the button here. Now we have to enter the code. Just go ahead and enter it here. And what I will get with this is a locked verified time. Now you can see I can't edit this. It has been locked. And this is how you know that you have a verified start time or end time. You can also just use a manual time if you do not have access to the code. Now I'll pick the preceptor that is associated with this rotation. Right here, the location should automatically populate if it is tied to the classroom. If this does not populate or if it's incorrect, you can always click here and change it. So now that we're done with the top section, we get into our first encounter. So HealthTasks does support multiple encounters or multiple patients. So each card here is going to be specific to one person. As you can see here, if we need to add more, we can just scroll down and click add another encounter. If I were to click this, now you see encounter 2. Now we have two different encounters that kind of look the same. So this is the information that populates just based on the templates for your classroom. So this is what your educator would like you to have. If there are any fields that are required, you would see this red asterisk. So right here, we know that these are optional fields, but nevertheless, it's something that our teacher would like. What we also do have is a AI scribe here. So if you would like to click this to dictate your note, you can talk to it and say like, I took care of a 3-year-old patient in the hospital, and it would start populating these fields as appropriate. You can also ask it to add ICD codes, or you can just search and type. So I could just either look up the code itself, or I could look up something like hypertension. And then either way, we would be finding the results. Okay. So that's how we use ICD codes. We can also just click in here and start adding some demographic information for this log. And then down here is where we get to select the skills that we did during this rotation. So these are the skills that are within the template for the classroom. So let's say that I did an IM injection. Maybe I performed it once or assisted it once, or maybe both. Down here is where we do things that are not in this list. If we did something else, like let's say an x-ray, I could always say that I did that down here, and then I can add it. And once again, put the level of ability, performed, assisted, or observed. So let's say I performed this. Now, if I wanted to generate a SOAP note, I could write in a brief summary for this patient. So I could say, and I would click generate SOAP note with AI, and this is going to give me a SOAP note draft. So it's not going to give me a full usable SOAP note, but it will get me started with formatting and start prompting me for some of the questions that I should probably be asking myself when I'm trying to write a good note. So you can see here's kind of a starting point. Down here at the bottom of it, it'll also look for some issues. So if there's a discrepancy with the age range, we obviously said young adult, 18 to 39, as you can see up in the demographic box right here. And yet I said this was a 3-year-old. So there is an issue here that the AI has caught, which is nice. So this could be notes for a separate person. So now we know we're logging another patient here. So we could just put in different information. Let's say maybe COPD for this person here. Maybe pneumonia as well. So we could start saying other viral pneumonia. And now we have maybe a patient assessment at least. And this is essentially a note now that has 2 patients. Now I can keep adding more encounters if I had more patients. If I needed to add 3 or 4 or 5 or something like that, I could just keep adding. If you do add a patient and then you decide, oh, I actually don't need this anymore, you can just click the trash can icon, and then that will delete the patient. You can just have to confirm that, and now they're gone. So you can see I have 2 encounters. Now what I'll do is submit this log, or I can save this as a draft, or if for some reason you don't need this anymore, you can always delete it. So let's go ahead and submit this as a log. So now this will go over to my preceptor, and you can see that it is now a pending log. Now if I click back on this, I can open it up again, kind of see what it looks like. At any point in time, I can add comments over here on the sidebar. I can also edit this note. Since this has not been approved yet, it's not locked down, so I can keep editing it. I can also duplicate this to a new note that just kind of copies all of the information that we have here. This is a status of one that has been approved. You can see the entire history over here. For example, this one was prior rejected, but then it was approved. So you'll see this next to it. And that's how you add clinical logs in HealthTasks. Thanks.